We are here at Mobile Infirmary. This is Dr. Jacob with the Diagnostic and Medical Clinic here at Mobile Infirmary. Good to see you.
Good to see you.
Thank you so much for joining us here on Studio 10. Today we're talking about the cardiology department here at Mobile Infirmary. Tell us a little bit about this department.
Well, this department is a big part of the practice we have here at Mobile Infirmary. It's been expanding and growing very fast and getting to the cutting edge of all the technologies we have available, especially to treat all structural cardiac issues, attempting to treat them percutaneously with minimally invasive surgery.
So we're going to tell you about 3 new procedures today. One of them is TAVR. You're going to tell us about that one. We have this in front of us. Tell us a little bit about what TAVR is.
Okay, well, TAVR stands for transcutaneous aortic valve replacement. It's very known that as people get older, some of the valves get calcified, thickened, and do not open very well, and would cause something called aortic stenosis. Aortic stenosis can present as shortness of breath, fatigue, weakness, chest pain, and if your doctor finds out that your valve is very tight and need to be replaced, historically we have been doing them via open heart surgery where the valves get removed, replaced with a new valve. But over the last few years, technology got advanced where we can deliver a similar valve through the skin and be placed in the position of the old aortic valve without having to open the chest at all, and all done through a small incision in the groin. This is the delivery apparatus. The valve would be mounted at the tip, and the catheter goes through the groin all the way across the old valve, and then the valves get deployed and expands open and takes the position of the old defective valve, and now the patient has a good functioning valve and they feel much better instantly.
Now we're joined by Dr. Eways with Cardiology Associates of Mobile. Doctor, thanks for joining us. We're going to talk about the other 2 procedures this morning. Tell us what these 2 procedures are.
Well, the first is what we call the Watchman. This is a procedure in people with an irregular heart rhythm, atrial fibrillation, who are at risk for forming blood clots. The standard treatment has been to put those people on the blood thinner, as we find a lot of people can't tolerate a blood thinner. So the Watchman is an answer for those people. People with atrial fibrillation and blood clot, most of them form in one little pocket called the left atrial appendage. This pocket right here on the model, about 90% of the clots form there, so if you can't put somebody on a blood thinner, the Watchman is a plug type device that we can put in through a catheter and seal off that appendage and then eliminate most of the risk of blood clots in those people.
Incredible technology. Also, we have Mitraclip here. That's how you pronounce it, correct?
That's right.
All right, so tell me about Mitraclip.
The Mitraclip is just like it sounds. It's a clip device. It's used for people who have a heart valve that doesn't close properly, that leaks backwards, and so blood is pushed backwards into their lungs. The usual treatment for this is open heart surgery to repair or replace that valve. We find now as our patients get older, a lot of people are not good candidates for valve surgery, for open chest surgery. So the Mitraclip is a way, again, through a catheter to go in and repair that valve. It's sort of an incredibly simple idea. Through this catheter, we put in a little clip device. It pinches the leaflets of the valve together and reduces the amount that it leaks backwards, and works very well. Right now it's a procedure just for people who are at too high risk for some reason for open heart surgery. Some of those patients previously, the Mitraclip patients or the TAVR patients, we didn't have anything we could do for them. As far as the Watchman patients, those people we have on blood thinner or we couldn't because they had a bleeding problem, and we just had to take the risk of a blood clot or stroke. Now we have more options for more patients, really.
And that's great news for all of you out there who are seeking treatment or need treatment. If you'd like to find out more, we've got a link to Mobile Infirmary and Infirmary Health on the Studio 10 tab at fox10tv.com. Thank you so much for showing us these latest and greatest procedures that y'all have.
You're welcome.